Hi, my name's Joe Bellick, and I'm the founding partner of the law offices of Bellick and Fox. We support the mesothelioma community by providing first quality legal representation to mesothelioma patients and their families. We're proud to support the Mesothelioma Applied Research Foundation so they can continue the work that they do every day on behalf of mesothelioma patients and their families.
At MRHFM, we exclusively help mesothelioma patients and their families. It's all we do.
This is why we are proud to sponsor the Mesothelioma Applied Research Foundation and its work to fund mesothelioma research and provide support services and education for patients and their families.
Hello and welcome to this episode of MesoTV. I'm Julie White and I'm the Patient Services Director here. And today we're joined by a very special panel of guests. Today we have Dustin, David, and Judy with us. They are all mesothelioma survivors and they're going to share their experiences with us. First of all, I wanted to welcome you all and say a massive thank you to each of you for being here and your willingness to share your stories. But this episode is about reoccurrence, but more than that, it's about the journey that each of you has gone through and are currently going through and letting people know what it is and, more important, hear your stories. I thought I would start by asking each of you a little bit about yourselves, how you were diagnosed, your initial treatment and or surgery. Why don't we start with you, Dustin?
So my name's Dustin Holston. I'm from Bancroft, Idaho. Got a little family of 5. I got diagnosed in 2018. My stomach started bloating, and I never did really feel sick, but my stomach started bloating, and I went into the doctor, and I had a couple liters of fluid on my belly, and they drained it. And long story short, with more tests, they found out I had mesothelioma, a peritoneal mesothelioma. And then I went to Huntsman Cancer Institute in Utah. And got surgery for that. Pretty much a month later, they got to me really quick. I did the HIPEC surgery, and then I did some rounds of chemo afterward. And that was about it for my initial treatment. The chemo was really hard on me. I only did about half of my chemo because I threw up about every 10 to 30 minutes for 7 to 10 days straight, and so I opted to do about half of that. And then
Which chemo did you have?
What's that?
Which chemo did you have? I'm sorry.
Oh, I did cisplatin and
Pemetrexed?
Yep.
All right, thank you.
Mm-hmm.
And Judy, how about you?
Yes, hi. I'm from Jersey, and I was diagnosed in April of 21. Had no symptoms, and it was found during a routine ultrasound. They found fluid in my abdomen. With that, further testing was done, biopsies, CAT scans, and it was confirmed in May that it was mesoperitoneal. And I had surgery in June of 21 with no treatment. I had the cyberduction surgery with the HIPEC. Had multiple organs removed. Some were infected with the disease and others were just taken out because of no need. They did not do any treatment after. They watched me by surveillance, and that was their protocol, not to do treatment after.
I see. And how about you, David? Can you tell us about your...
Yeah, sure. Yeah. My name's David Staley. I'm from Manchester in the UK. I was diagnosed at the age of 39 back in 2015. Got a wife and 2 kids, and it was actually the day before my daughter's 6th birthday that we found out. I've been having symptoms, flu-like symptoms off and on for about 18 months. So it took 2 biopsies because it wasn't hitting any of the meso markers, never worked with asbestos, etc. So they never knew exactly what it was. So when it was confirmed, it's, it's life-changing, it's devastating. So we had the option of chemotherapy and or surgery. So having spoken to numerous specialists, we went with surgery and chemotherapy, and I had the full EPP. So I had my left lung removed, part of my chest lining and part of the diaphragm. And that followed four rounds of chemotherapy, cisplatin and Permitrex. And me too also. It was horrible chemo. I've said many times I'd rather have my lung out again than chemotherapy. But you get through, you get through it, and plenty of medication, etc. And so that was back in to April 16. I finished my chemotherapy.
Yeah. So all of you made it through the initial, and then were told that you were, excuse me, you were in the clear, no evidence of disease at that point, right? So I know that first,
sorry to interrupt on that, but interestingly, in the UK, I've never been told I've had the all clear. They've always said to me from day one, and they say to everyone, it will always come back. They've never said to me that it will, that you're clear. They just always say stable.
Same here.
Stable. Okay, right. Yeah. Stable meaning that at this time, there's no overt evidence of disease, right? Yes.
Yeah.
Right. That's what I was meant, yes.
Yeah.
But, well, let me back up 1 minute and ask, did any of you, of the three of you, go to see were you seeing a meso specialist? I know a lot of people wonder.
So I know that the lady who did my surgery had done the cytoreductive surgery in the HIPEC a number of times. She came, I believe, from Texas about a year before. So as soon as I talked to her, I don't know if she was a meso specialist. And my oncologist definitely isn't like a meso specialist, but everything that they've done seems like it's been protocol to what I've seen as far as other people doing their treatments. So I don't know if she was a specialist, but I know that she'd done the surgery a number of times.
Okay.
I'm fortunate in that both when I was diagnosed, he wasn't a meso specialist, but he put me in contact with two consultants that were. So my oncologist purely he's in lung, but he mainly does mesothelioma patients.
Yes.
And my surgeon, all he operates on is mesothelioma. So they are specialists in the field, which gives you greater
confidence. Yes. Okay. And Judy?
Yes, my surgeon, he was a specialist in meso. I have to follow up with a medical oncologist at the time. My surgeon followed me on,
yes, continued to follow you. Yes. Okay.
Me and ordered the CAT scans and followed me closely.
Okay.
So.
Okay. Yes. I know that as you said, no one ever said you were in the clear. I apologize for that term, but that you were stable. And I know a big worry for a lot of people is that, is it going to come back? When's it going to come back? And so one of the things that I was going to ask is, can you each, there's a lot of anxiety before every scan. Could you each speak to the fact that, or tell me when yours did come back, when that happened, and kind of how you felt and what was the circumstances around it? Whoever would like to start.
You want me to start?
Sure, Dustin, I know you have.
Okay, so I was no evidence of disease for about a year and a half or 2 years or so. The only reason I bring this part up is I had a son pass away in 2020. And the only reason I bring that up is because I know that the sadness got in my body, and it made I knew that it was going to make it hard to fight the cancer. And literally 3 months later, it might have been 4 months, I was back in to do another cytoreductive surgery. So they found it on a CAT scan, and I went in to do the surgery, and I woke up with just a small incision on my lower belly, and I knew that it was bad. And so what my doctor had told me is that when she got in there, and so when I first got diagnosed, I had it everywhere. The doctor said it was like they dumped a bucket of sand in my stomach. Well, this was the same case. It was everywhere, but it was a lot bigger. And she told me that I wasn't operable, and that and I ask this question just because I like to know the odds to beat, just because I know I can beat them most of the time.
Yeah.
But I asked how long, in a worst case scenario that I had, and she told me about 3 months, 3 to 6 months. And so it's the first initial reaction was super, just terrifying, of course. So I went home from the surgery. We made appointments to come up with a plan. I tried carboplatin on the next round of chemo, because it's supposed to be easier than cisplatin.
Right.
And it was actually worse for me. And so that was really hard for me, because I actually was wondering if the treatment itself was going to hurt me worse than it was going to help me. So I went into my doctors and I told them my concerns, and they put me on immunotherapy. It was Keytruda or pembrolizumab or whatever it is. Yeah. And it did really well almost immediately. I went in for my next CAT scan was 3 months into it. And I had my gallbladder removed in my first surgery, and they actually had to call me back in because they were worried because my gallbladder disappeared on my CAT scan. And it was actually just a tumor that was in place of it. And so I got stable after that first CAT scan. I was stable for a while. And then I had problems with bowel obstructions. And I ended up getting one bad enough to where I ended up having to go in for surgery. I couldn't eat for a couple of months. That was really hard. We went in and I got that fixed. And when she opened me up, my surgeon actually saw that everything that they'd been reading as stable was actually just scar tissue. So it messed up my stomach quite a bit. I don't know if it was, I'm sure it's just the scar tissue from the cancer itself, but it turned into like a weird orange peel rind around my stomach. I can't do any more surgeries as far as if I get a blocked bowel. I can't, as far as they told me that I can't do anymore. But they closed me back up. I still couldn't eat for quite a while, but this didn't really have anything to do with the mesothelioma. But it did from the treatment and stuff. But
Yeah.
it was actually SIBO, long story short. But the Keytruda though, it worked amazing for me. I had zero side effects at all. Not any that I ever. So it was, I don't know, it was quite amazing. I actually felt bad going into treatment, knowing that other people were getting some hard treatment, and I was, headed out to get lunch afterwards and stuff. But I don't know.
Been through enough.
with that treatment working quickly, and it helping a little bit right off the bat, the Keytruda, that my fear it diminished quite a bit, because I was like, oh wow, it's done its job. I've been now off of the treatment for about two years now, and I just went in for a scan about a month ago, and everything's still good.
That's awesome.
Did they say the Keytruda is still doing its job and working? Because I've heard stories of when you have immunotherapy, and which is similar to Keytruda, I believe it can still work years afterwards, and because it boosts your immune system, doesn't it? So I think, do they say that your immune system's now recognizing this cancer and killing it off without any extra medicine?
So I haven't actually asked my doctors that itself, but I have read the same thing that it's supposed to.
You're
and I haven't really asked them too much
right?
about. I do believe that if it does come back, I can ask them to pop right back on it, and hopefully, it does the kind of thing for me. But I know that they told me I was going to die really quick, and they told me that I would never eat again ever in my life. They told me that's no way, because your stomach's too messed up, and I know that I eat just fine, and I am doing good.
You're
So
not dead.
my main message to people is on the fear Because like I was saying, when my kid went down, the sadness and fear and all the negative, I believe that it actually makes it makes it harder to fight cancer.
Yeah.
If you can try and limit it a little bit, it definitely, I believe, helps you a
Yeah.
lot.
Positive attitude is a lot of it. You're right. Yeah.
Hmm.
So Judy, what about you?
So I had a reoccurrence in April of 23. It was found in a CAT scan. So they were unsure whether, they saw two spots. They thought it might have been scar tissue. They decided to chase it with biopsies. So I had to go under twice, two different times. They went in and it came back active cells. So that was about May of 23. In June, I started on immunotherapy, Opdivo and Urovoid. Started the end of June, and I was on that until October. My scan showed some fluid in my belly again. During the time, they were following me every 9 weeks with a scan.
Mhm.
So everything looked pretty stable until that fluid popped up in October of 23. They said, well, you know what, let's give it one more round. Let's wait the 9 weeks and see where we are. Decided caution. They were keeping an eye on it. It was very, very little fluid, but I think it was drawing a red flag to them. And then in January, the fluid had increased.
Mhm.
So they thought the immunotherapy was not doing the job that they wanted it to do. So I went in for my second surgery in February of 24. Ready to go, getting psyched to get this out again. Nervous, of course, because it is a lengthy surgery. I was told I was going to probably be under for about 9 to 10 hours again. But I was ready to go. I'm ready to fight the fight. And, I woke up in the recovery room and I immediately asked the time. And they said it was 11:30 in the morning. And I just said, yeah, this didn't work, because they took me in the OR at 7:30. So I knew at that time that something didn't go right. And it was true. It was true. It was confirmed that they had to abort, that it was inoperable, and they couldn't remove it. So it had hardened kind of like cement, they had said, and they couldn't scrape it. So it wasn't worth taking the chances to pursue it. So they closed me up. Unfortunately, my scar was quite lengthy. It wasn't a little one. So it was the whole torso area that they had opened me up. So I'm still kind of recovering from that. I'm about 4 weeks out, I believe, or maybe 5 now. So the next line is chemo, which I'll be starting on Tuesday.
With
So,
bevacizumab, right?
yes, Corbo and Pemetrexed. Yes, and I had transferred now, since surgery is completely off the table. I had transferred all my records now to a medical thoracic oncologist at Sloan, who is a meso specialist.
Yeah.
Because I couldn't find one in Jersey,
Yeah.
so I had New York.
Okay.
So
Now
so that
you're ready to start this fight, right?
now I'm ready to start this fight. Right. Yeah. So I'm glad he gave me 2 more weeks to heal and get stronger, put a little weight on, and get ready for Tuesday. Right. So
Okay.
You say you're 4 weeks out of surgery?
yeah, about 4. Yeah, about 4 or
You're
5.
amazing for that kind of surgery. I think at 4 weeks I was still laying in bed, barely moving. So you are.
For your second surgery?
Oh yeah, no, I guess my second. Oh yeah, that's right. My second one.
Yeah.
No. Yeah,
Was
they didn't go all the way. Yeah, so it's it was much easier.
Yeah, the first one was tough.
Yeah.
Only because
Yeah, that's why I'm sorry. I was thinking that you just came out of the full abdominal.
Yeah.
So
they cut me, and they didn't do much work inside.
yeah.
So, I'm just kind of trying to get that to heal, and anything cutting through scar tissue, abdomen, is time to recover.
Yeah, totally.
Yeah.
Okay, David, how about you now?
Yeah. So I've actually had a couple of reoccurrences. I've just hit me 6 years back in October 21, and I was sitting in my chair, and I felt a little lump on the back, and I've still got the lump there now. It's on the scar tissue. And that was biopsied and confirmed as meso, but it wasn't showing up on any of the scans. It's just where it is, right on the edge. Do you think with taking the lung out, maybe a small fibre or something's dropped and they couldn't get everything out? So, but it caused me a bit of pain back then, but nothing since. And then in February 23, I've been going to 3-6 monthly scans and checkups. And so February last year, not only did they find a cancer, some nodules on my right lung, but also in the space where my left lung was and close to the heart lining. But it was small growth, so they were debating what to do. So they focused on my right lung, and that is potentially, there's a debate whether that is mesothelioma or whether it's adenocarcinoma. They can't confirm, and unless they do a biopsy, we will never know. And there's too high of a risk of punching my right lung to do the biopsy, so we agreed not to. So I had radiotherapy, which it was targeted radiotherapy. There's a special name for it, and it has passed me by. I might remember it in a minute, but it's precision. It's amazing. It hits. First time I've got tattoos. And the little, it's like a pen mark on the end on your body. That's how small it is.
Was it CyberKnife?
Pardon?
CyberKnife or proton therapy?
Yeah, it's more proton. It wasn't proton. There's another name. And I can't remember for the life of me, but similar to that. And it just hits that spot. So this, Justin, you were talking about
targeted radio.
Yeah. And there was no side effects from it, which is, I got fatigue from it, tiredness, whether that was from the treatment or all the stress of it. But other than that, compared to chemotherapy, it was good, and I could go out afterwards or go for lunch, but it was more the tiredness that got me. So that came back last year, and then the left side is where there's a couple of nodules, and that had increased in October last year as well. So there was a big debate of what to do. And, you've mentioned, we have scan anxiety. I don't think you can get over that. And sometimes in the UK, unfortunately, you can be waiting 6 to 8 weeks for your scan results, which is just horrendous. I've now gone
8 weeks for a result?
Yes. Wow. And if you're on 3 monthly scans, so you have it on day one, then you're waiting 6 to 8 weeks for your results. You might get your results after 2 months, but then you're having another scan in a month's time. So you're never out the cycle. But I'm fortunate recently that I've been able to, with work, I've moved over to go to private. So I'm getting the results within a month, but not everyone has that opportunity, you see. So some hospitals are better than others. It just depends on staffing and resource and busyness.
Patience, right?
Yeah. So, once it had grown in October, that did cause us a big worry of what to do. We came out of it. They said, let's watch and wait. Let's not do anything just yet. But then I come home and thinking, I've got cancer inside me. I can't sit and do nothing. But then you've got to trust these specialists. You've got to listen to your body, of course, but you've got to trust the specialists. And we had plenty of discussions with various ones. And now in the end, we decided we would watch and wait. And I had a scan in, rather than having a 6 monthly scan that was on, I went to 3 monthly. And in January, the last one, there was no growth compared to the last scan. So we're just watching and wait. And I think I'd just like to say on top of what Justin said, really, with and we touched on with the positive attitude, the difference I believe that can make. And I always remember my surgeon telling me he sees two types of patients: the ones that are more positive fare better, and they you know, from his experience. And I know it's not easy. It's not easy by all means, because you do get those negative thoughts of, is this it? You know, is this my time up? And yet you're always going to have them building up to the scans. Yeah, I don't think you know, I try and keep myself busy doing odd things, or you know, going to the gym, go for a walk, or doing stuff with the kids, but just keep distracted around that scan time. But yeah, my mind's definitely elsewhere as well. It's hard. It is hard.
I was going to ask if there was a time that any of you felt like giving up, and I know a lot of patients have those feelings sometimes, and if what you did to help push forward. And it sounds like you're saying, David, that you just try to keep busy. And
yeah,
do you have any opinion?
I do. I've not had them. I've not had them thoughts. I have had, and I'd recommend anyone. You know, I have had counselling, specialist counselling to help me through these situations. So that would be my advice. But when I've got a young family, a wife, great friends, great family, you know,
good support system, yeah.
The support network is massive, and it keeps you going by far.
That's
and
awesome.
You know, I am still working as well, which gives me a good distraction.
Yes. How about you, Dustin? I know it sounded like you had a really rough patch with when your son died. So what helped you to push through that?
Like David said, it's my family. I have a wonderful wife, and I have another daughter and another son, and it's them, and you know, just the love of life, the love of snowboarding. I don't know. I've never really felt like giving up at all. The only time I ever had any kind of like negative thoughts was during chemo. And I think anybody who has chemo in their body you feel so sick.
Yeah.
You just feel a little negative during that time. And you know, I felt great as soon as I started feeling better. So
good.
from the chemo. So I've always just tried to stay positive. And, you know, when you're surrounded by love, keeps you going.
Yeah. Judy?
Yeah. No, not yet. Immunotherapy, I did, you know, mentally, physically very well on. So there was nothing in me. I mean, I felt stronger than ever. No side. I ate well. I lived the summer to my fullest. Immunotherapy was very agreeable. So now going into this fight, a little anxious, but ready for it. My family is amazing, you know, with their support. They would never allow me to give up the fight. So they would keep pushing me to move forward. And my faith helps me through it too. So talk to me in a couple of weeks. But yeah, I'm hoping that the chemo isn't going to break me down too much.
Right.
So
I was going to ask if you all had one piece of advice to give to someone who's just starting this journey with mesothelioma. What would be the one thing you would say?
You know, so here's on the fear thing, I wanted to bring this up because you do get super, super scared. And I forgot to mention how helpful reaching out to other people and other patients was, especially, you know, if you get on the Meso Facebook page, there's many stories of survival. And I was totally thinking I was a goner after I got my recurrence. And after talking with some people, it mellowed me so much. Like it helped me so much, because there's actually crazy stories of people actually just rolling stable for 14 years. And like, I mean, so my advice would be don't do this on your very own, and actually reach out to other people who have been through some stuff to try and ease that mind. That's
peer
my
support,
main advice right there, is to
and we have the
try
Facebook
and get
support
that mental
Mhm.
mental stuff down. And that helped me so much.
Thank you.
There was a few of them actually.
Okay. David or Judy?
Yeah, I agree with Dustin 100%. I mean, the Meso group is a wonderful group of people. They're so giving and sharing of their time. Even last night on a Zoom call, when you hear stories of two people that, went through chemo and they got through it, with barely any side effects. Everybody is different. That's what keeps me going. There's always hope around that corner. And this group is just a wonderful group. I've made friends through it that I private message through and on trials, and they keep me going because they've been through the chemo, and now they're on trials, and they go out and they plant flowers and they're living their life, and it just helps. It helps to be with people that have this same, disease.
It can be
And
very
see,
lonely, right? If people don't understand exactly I mean, you can have the family, the friends, but someone who gets it, huh?
yeah, they don't understand it as much as they try. They don't
Okay.
until you actually can connect with, somebody like Dustin, who, now his story will carry with me, and David, so all these stories help all of us, I believe.
Yeah.
I think it is important. And David, how about you? You're one.
Yeah, when I was first diagnosed, you're told, and you go away and you look at the stats, and you're told you've got 12 to 18 months to live. And I was at a Meso UK ladies lunch the other week, and someone was telling me that, they're told to go away and get all your affairs in order, and you haven't got long to live. So my advice is don't read Google and look at the worst stories.
Yes.
They both said that, there's loads of positive stories out there, I'm 8.5 years on. I know there's others in the UK, 10. Mavis Nyes, unfortunately, just passed away at 14 years. And you've got Heather in the US who's on, don't know, 16, 17 years, whatever Heather's on.
I know of one that's 36 years too.
Yep. I just talked to somebody who was 1997, they were diagnosed. Yeah, so that's 30, 36 is longer. Yeah, but 19.
Well, and it might be that one. I could just be off on my number. I know it's in the 30s though.
Long time.
Wow. And it just gives you so much hope. And and we're all individuals, so that what might be for someone else isn't necessarily for you. And just keep believing, and there's a lot of good stories out there. And
That's wonderful. Although each of you do have different stories, I think the common thread is you're all survivors and you're all beating the odds. And I just want to say thank you again for taking time to share these experiences with others. And I think it's going to be so helpful. So thank you again.
Oh yeah, you're very welcome.